Hi everybody, Mary Ferguson Perret here, and I'm here talking to some VIPs from VIR. What that means is, and from pain. We are talking to folks today, the whole team from Vascular Interventional Radiology in medical imaging. And I want to begin actually by speaking with Salima Ladek, and you will of course know that she's our resident star and leader for the Corporate Pain Initiative, along with myself and many, many others. And we're just going to talk about the work that this team is doing, and then just get them to tell us a little bit about it. So Salima, how did this all get started?
Thank you, Mary. This got started because the team actually wanted to develop some more strategies on how to keep a segment of their patients more comfortable. And we decided to look at the patients who undergo radiofrequency ablation for liver lesions. And there's a lot of pain associated with that population. And so the interprofessional team actually invited me to talk about what the options are for pain management, how we could keep the patients more comfortable, what support systems they need in order for them to be able to do that for their patients. So it was really, initiated by them, and I just happened to come along.
And be the consultant and expert consultant. And Carol Dunham is one of our nurse managers here, and she's moved into the imaging area. And Carol, tell us how you got the team engaged, or how you all engaged in this, because a lot of great work is being done in imaging over the past few years around pain management, and just congratulations to you all in pursuing that. But Carol, how did the team get formed?
So we, as Salima mentioned, had some concerns around some of the patients and how we're handling their pain. And it was a broad concern of physicians and nurses and techs. And whenever you've got everybody on board, it's quite easy to get an initiative rolling. So we have our team here, and we're in the very early stages. So we're just getting off the ground with this initiative. As you mentioned, there have been previous initiatives in medical imaging. So I think we've got a lot of experience, and we actually have 2 pain resource nurses, which I think is quite unique. Glenn, who's not with us today, and Karen, who is.
And we'll talk to Karen in just a minute, but Rob, tell us a bit about how interventional procedures in imaging is really changing how we're going about doing things, and how important this is.
Yeah, we're doing a lot of minimally invasive procedures, different areas of the body, and a lot of them are sort of replacing more invasive surgical alternatives. So we think it's good for patient care, but just because they're minimally invasive doesn't mean they're not without anxiety or pain and discomfort. So this pain initiative has been helpful to make sure patients have the best experience possible. We want to try to prevent pain, as well as, if they do have pain, to treat it as best we can. So Salima's been very helpful in guiding us, and then we've got the physicians, nurses, and techs all on board and come up with a lot of good ideas, and we think we're improving and getting better, and we hope to continue to do so.
That is just fabulous. And so speaking of nurses and techs, here's Karen and Sue, and maybe you can talk to us about how you both help this to happen.
Well, as part of the multidisciplinary team down in VIR, we work with everyone to help assess patients and communicate as patient advocates to the team, and work with the team on assessment, best approach for pain management, and then reassessment to make sure that we're doing what we're supposed to be doing and helping the patient. And we work very closely with our techs, who also interview the patients, and so it's a good team approach.
And so I hear that the techs really have a lot to do with helping to sort of pause a bit to enable some attention to pain to happen. Is that how it goes?
That's what we hope to. We hope to, like Carol says, slow our procedures down a little bit. Sorry, I'm croaking now. And anyway, we spend a lot of time with the patients, and we do have some control over workflow and everything like that, and that's what we hope to bring to it. And Carol's getting us more involved in Karen, and more engaged, and also the drug aspect and the assessment more, teaching us that way.
Well, this is just a fantastic example of an interprofessional team who are really taking this seriously, and it's benefiting patients. And I was boasting a little earlier among all of us that we've done better year over year in pain management at UHN because we've paid attention and because teams like yourselves have got underway with new initiatives that have helped us to do better. And so thank you on behalf of our patients, and thank you for joining us. And hey, what can you be doing in your area to look at even doing better around patient satisfaction with pain? Let's consider that. So talk to you later. Thanks a lot. Bye-bye.